everyone, so let's move towards our today's topic, which is...
So today's topic is anterior cranial fossa. First of all, remember this, that the area of the skull where the brain is present, that area is known as cranium, and that cranium is divided into three fossas. One is anterior cranial fossa, which is present anteriorly. Then afterwards middle cranial fossa, which is present between the anterior cranial fossa and posterior cranial fossa, and on the posterior side there is fossa, that is, that posterior cranial fossa. Now in this video we are particularly gonna talk about anterior cranial fossa. इन क्रेनियल फोसा में आपको कौन कौन सी चीज़ें याद रखनी है. द मोस्ट इंपॉर्टेंट थिंग इज़ बोन्स, के कौन कौन सी बोन्स हैं. नंबर 2 इज़ कंटेंट, क्या चीज़ मौजूद है. बाउंड्रीज, कौन कौन सी बाउंड्रीज फॉर्म हो रही हैं. फोरामेन, कौन कौन सी ओपनिंग्स हैं. और कुछ अदर फीचर्स भी हैं जो हम आपको बताएंगे. आप इजी मेडिकल की बुक सामने रखें ताकि आपको इजीली सब क्लियर होता जाए. द बोन्स विच आर फॉर्मिंग द इंटीरियर क्रेनियल फोसा आर फ्रंटल बोन, ethmoidal bone and sphenoid bone. Before starting this topic more clearly, I would like to tell you that there are few bones which are forming the whole cranium, and the names of the bone are frontal bone, parietal bone, temporal bone, sphenoid bone, ethmoidal bone and occipital bone. Now among them, the parietal one and the temporal bone, are 2 in number, whereas the frontal bone, sphenoid bone, ethmoid bone and occipital bone, these 4 bones are 1 in number. So the professor can ask the bone which is present in the cranium, and that bone is paired in that bone is present in paired form. So tell me the name. The professor can ask you the question in this way. So you will say that के दो bones हैं जो anterior, दो bones हैं जो paired form में होती हैं, and one is among them is one is parietal bone and another is temporal bone. Okay. Now the anterior cranial fossa, the bones which are present in the anterior cranial fossa is frontal bone, ethmoidal bone and sphenoid bone. The content which is present in the anterior cranial fossa is frontal lobe. Obviously it is present in the anterior, मतलब front, और frontal bone है तो frontal lobe ही होगा cerebrum का. And another thing is present, that is olfactory bulb, which I will tell you in upcoming minutes, in few minutes inshallah. Okay, now some other contents are present, that is anterior ethmoidal artery, anterior ethmoidal nerve, anterior ethmoidal vein, posterior ethmoidal artery, posterior ethmoidal nerve, posterior ethmoidal vein. But these ethmoidal thing which I have told you, that are not much important, but you can easily memorize it. But I will tell you after few minutes. But the most important thing is boundaries. तो पहले मैं आपको boundaries बता देता हूँ, then मैं आपको ethmoidal की thing बता देता हूँ. ठीक है. Now what are the boundaries? Anteriorly क्या मौजूद होता है? Anteriorly मौजूद होता है frontal bone. Okay. Posteriorly lesser wings of sphenoid bone is present. What is lesser wings? Sphenoid bone consists of 2 wings. Sphenoid bone consists of 2 wings, lesser wings and the greater wings. The lesser wings are forming the posterior boundary of the anterior cranial fossa. Okay. Laterally, and obviously the greater wings of the sphenoid bone will present in the middle cranial fossa, and we will discuss in the next video. Now laterally, what are present in the anterior cranial fossa? Frontal bone and some part of parietal bone. Some books says के parietal bone मौजूद नहीं होती, सिर्फ frontal bone होती है, और कुछ books कहती हैं कि भाई some part of parietal bone is also present. So मैंने आपको दोनों चीज़ें बता दी. Now medially what is present? Medially ethmoid bone is present in the midline. Now what are the foramen and what are the other features of the anterior cranial fossa? Remember this thing. In the middle line of the anterior cranial fossa, in the midline, there is a plate, thin plate, which is very easily fractured. That plate can easily fracture, and that is known as cribriform plate. Now what is cribriform plate? It is the plate through which the olfactory bulb can enter into the anterior cranial fossa. Olfactory bulb is formed by olfactory nerve which is coming from the nose olfactory nerve come from the nose. They form a one nerve, the one large nerve that is known as olfactory bulb, and that is known as cranial nerve 1 also. So that will pass through cribriform plate. Now another point is orbit. What is orbit? Orbit is the area in which eyes are present. अब आप देखें, आपकी आंखों के बिल्कुल ऊपर जो स्कल का एरिया है ना, क्रेनियम का एरिया, वो है एंटीरियर क्रेनियल फोसा. सो द पार्ट, और एंटीरियर क्रेनियल फोसा में कौन सी बोन है? फ्रंटल बोन. सो द पार्ट ऑफ द फ्रंटल बोन विच लाइज जस्ट अबव द आईज, ठीक है, वो एरिया, अब आप अपनी आंखों के ऊपर हाथ लगाएं तो आपको बोन नज़र आएगी, बोन फील होगी कि एक सॉलिड चीज़ है, तो वो बोन है. और वो बोन कौन सी है? फ्रंटल बोन है. अच्छा, वो फ्रंटल बोन तो है, लेकिन वो फ्रंटल बोन का जो प्लेट है वो दैट इज नोन एज ऑर्बिटल प्लेट. ओके, नाउ व्हाट इज क्रिस्टा गिलाई? On, like I said, in the midline there is a cribriform plate. So on each side of the cribriform plate there is an elevation of the bone that is known as crista galli, by which fox cerebri will attach. What is fox cerebri? Fox cerebri basically क्या होता है? Fox cerebri are the foldings of the meninges, and particularly if we talk about the folding of the meningeal layer of the dura mater. ड्यूरा मैटर की दो लेयर होती है, एंडोस्टियल लेयर है मेनेंजियल लेयर. मेनेंजियल लेयर फोल्स बनाती है. वन ऑफ देम इज फॉक्स सेरिब्राई. नाउ few other foramen are also present, that is anterior ethmoidal foramen and posterior ethmoidal foramen. Like I said in the beginning, it is very easy for you to remember. Anterior ethmoidal foramen, through anterior ethmoidal foramen, what will pass? Anterior ethmoidal artery, anterior ethmoidal nerve, anterior ethmoidal vein. So simple. Another foramen is known as posterior ethmoidal foramen. Posterior ethmoidal foramen, through which what will pass? Posterior ethmoidal artery, posterior ethmoidal vein, posterior ethmoidal nerve. So this was the whole topic and anterior cranial fossa. Now middle cranial fossa we will talk about in the next video. So take care, work hard, study hard, and good luck. Bye. Thank you so much.